If you have a question for Dr. Zorba Paster, well, now is the time to call in. The number 270-9933.
It's a great day to call. If you have a medical question, the phones are wide open. Dr. Paster is standing by at his clinic in Oregon. Hi, Zorba.
Hi, how are you doing?
Good.
Very good. Good to see you. While we're waiting for some of the calls to clear, let's talk a little bit. There is some very encouraging news when it comes to treating cancer.
That's right. Cancer deaths, when we look at cancer deaths or percentage of deaths, they're actually going down much more dramatically than we ever thought. Now, a lot of people are still getting cancer because the population is getting older. But if we look at breast cancer, colon cancer especially, the two major cancers, and even lung cancer, which is the #1 cancer that we have, the numbers are improving. And so then you look and you say, why are the numbers improving? First of all, for lung cancer, fewer are smoking. There still are too many people who are lighting up, but there are fewer people every year that are doing it, and that's a really big difference. When it looks at colon cancer, the difference is we're eating better, we're exercising more, which reduces the risk of colon cancer, and we're getting screened. And we look at breast cancer, mammography, regular mammography has made a huge difference. New medications have really helped when people have metastatic breast cancer, but it's really early detection is the cure. So I think all in the front, we really are seeing some good news on cancer, and it's always good to have good news on healthcare.
Absolutely, especially cancer. So it's lifestyle, it's health, it's the medication,
it's lifestyle,
all sorts
it's
of
health,
things.
it's screening, it's everything all together. Now, keep in mind, from a cardiac point of view, we are doing much better when it comes to stroke reduction and heart attack reduction, but I think cancer is finally getting caught up, and I think we're getting a better handle on how to pick it up and how to actually treat it.
All right, this flu season seems to be kind of bad this year. A toddler died last week.
Right, right. Influenza, always an issue. I had somebody in my office today who said, is it too late to get a flu shot? And I said, no, it's never too late to get a flu shot. And the answer is, for anyone who's not gotten the flu shot, now is the time to either call your doctor, go to your pharmacy, get a flu shot. It's so easy now that pharmacies all get flu shots pretty much across the state, and it's really important. Influenza is always bad this time of year. I think this year is going to turn out to be one of the worst years because you said a toddler recently died. Everyone should get a flu shot. It really does make a difference. And of course, it doesn't help you with the common cold, but it helps you with influenza, which is the common cold that can kill you.
All right. Let's go to the calls. We'll start with Terry in Mineral Point. Hi, Terry.
Hi, good afternoon.
What's your question?
My oncologist is just transferring me over to a new drug called Zytiga. I've been waiting for approval because the copay on it is so incredibly high. But I got a grant to cover the copay on it, and I was wondering if Dr. Zorba has had any experience with it. Just curious about what. Just curious about side effects.
Right. Unfortunately, I don't have experience with that. That's really where the oncologists do. They kind of know which drugs are best and then what the side effects are. Some drugs, you know, each drug has different side effects. That one I'm not familiar with. But once again, it's really the expense of some of the oncology drugs that are the real issue. And getting a grant for that copay can make a big difference in your care. So make sure you get that.
All right, let's go to Gary in Stoughton. Hi, Gary. What's your question?
Hi, Dr. Zorba. I do a lot of hiking, and my large toenails have lifted off of the toes, and they continue to grow that way, but they're no longer attached to the toes, and I'm wondering, is there anything I can do to get them back onto the toes?
Oh, sure. Well, first of all, sometimes you have to actually go to the doctor and get the toenail removed because then it'll grow back initially from the base of the nail itself. So often when it's sort of above, it's sort of like an ingrown toenail, a little bit worse. You've got to have the thing removed, and then a new nail will come in and come in properly. While you actually have that nail that's up, taping it can make a difference just with a Band-Aid or a piece of tape, but there's no magic way to actually get it to sit down on the nail. Once it comes off, you need to get the nail removed to get it to grow back the right way.
That sounds painful.
Yeah.
It does. Well, we freeze it, but it's painful when you freeze it.
Just don't rip it off. Okay, that's good. All right, Tony in New Glarus. Hi, Tony. Tony, you there?
Hello.
Hi, what's your question?
Yes, I'm here. I had the knee replacement surgery on my right knee 2 years ago, and since then, the pain in that knee has gotten worse and worse. and I don't know what to do about it. I went back to the surgeon, and he took an x-ray, and all we saw was a nice titanium knee. But I'm having a great deal of trouble with it. I'm wondering what you suggest.
Very often, when you've got post-surgical knee pain, physical therapy makes a major difference, and doing those exercises for 8 to 12 weeks every single day. And what happens is often people will stop after a few days or a week, and they'll say it's not getting anything. You just have to keep it up, because you often are rehabilitating the muscles and the ligaments around the knee. The joint is usually good, the titanium joint, but it's those muscles and ligaments that actually cause the problem. The other thing, of course, is temporarily taking 2 naproxen in the morning, Aleve, 2 Aleve in the morning, 2 Aleve in the evening, if you can tolerate, can also make a difference. But PT is the ultimate answer.
All right. Good advice as usual. Thank you, Zorba. Thank you, everyone, for calling in. We'll do this again soon.
Yeah. Zorba, thanks so much. Good to see you.
Great to be here.
You sound better than last time.
Yes, much.
Thanks. My cold is better. Thank you.
All right. We'll be right back with the final check of your forecast.